We're going to talk about it very, very briefly. And those people listening to this who are in healthcare, thinking about healthcare, or maybe currently in healthcare, or maybe they're a family member somewhere, right? You fall somewhere on this spectrum. So, the first reason, the most common reason that I could gather, the first reason, the number one reason why people want to leave healthcare is staffing. Is staffing. Doesn't matter if you're long term care, doesn't matter if you're med surge, doesn't matter if you're ER, critical care, doesn't matter where you are. Staffing seems to be a problem. It's because we don't have safe nursing nurse to patient ratios. We just don't have it. If we had that throughout all the United States, there'd be a lot less problems. Family. Your family member will be taken care of better if there's proper staff. So my new grads, you wouldn't be as stressed out if you had proper staff. Right? Senior nurses, you wouldn't be as burnt out if you had proper staff. If you had proper staffing. So it's a problem throughout. This isn't a new thing. It's not, nothing new under the sun, but this is a consistent thing that has been a problem. So that is the number one reason why people want to leave. Another common reason I see people say is money. And I will briefly talk about this. Now, I think some people misunderstood. I think people really got into nurses' business during COVID. And if you know, you know. So people really had they got to peer into what some few nurses were making during the pandemic, handing out that COVID relief money, paying people all kind of stuff, all kind of pay just to come work during the pandemic. And some people thought, that's the norm. And we're nowhere near the norm. And when it come to find out, we had doctors that were angry that a nurse was making more than a doctor. Now, I'm not here to argue schooling. I'm not here to argue responsibilities. All I'm saying is you gotta be more mad at that facility than the individual. Because you're comparing a doctor who's staff and maybe they're a resident, maybe they're new. I don't know how long they've been there, but that's not an everyday thing where nurses are making more than doctors. Let's just clear that out there. Let's just clear the air right there. But that was a thing for a little bit during COVID. So, but people were thinking like, oh, nurses make a lot of money. I'm like, no, they do not. Nurses do not make good no money. Not like they should, not like they should. So let's get that out the way. And then the top end nurses may be making decent money, but that is that no, nurses aren't paid enough. So money was a common factor. All right, let's talk about another reason why, and I know this one right here is going to be very controversial, is people said family members. Now, why is that? Why is that? There's somebody probably not in healthcare listening to this. They're thinking, what do I got to do with it? Well, sometimes, let's just talk about it. Let's be honest here. Sometimes you guys can be extremely selfish. And I get it. You want your mama, your papa, your son, your daughter, you want them to have the utmost care and you want them to be attended to. As soon as you hit the call light, you want staff to be right there. And guess what? They're hurting, they're stressed out. So I mean that stresses the family member out. They don't want to see their loved ones in pain. They don't want to see their loved ones sick. And they want you to be a miracle worker. When that nurse has another somebody else who has respiratory problems and they have to call a rapid, you got another patient who's having a reaction to blood. You got somebody else that's having continuous bladder irrigation, or you got somebody else who literally just has somebody pass away, and you're mad because your Mima or Papa ain't getting a sandwich, or he's thirsty, and you're wondering where is everybody. I mean, I think if you guys would take the time, it would really, really help if you guys would have a little bit of compassion and do a little bit of research on what actually goes on. Actually, if you would take the time to actually talk, go call during the day. Go call the manager. Say, I want to speak to the manager. Can you give me an understanding of everything that goes on? Because it seems like care takes for it takes forever for somebody to reach the call light. Well, call the CEO. Let them know. I've been saying this for a while. Family members, you need to let these people know. And then if they're honest, if you talk to the nurse, they'll say it's staffing. Family members, the best thing you could do is tell the manager face to face or talk to the CEO face to face and say, "Can you get these people more help?" That's the best thing you can do. Tell them, like family, tell them, we need more help. They need more help. If they get more help, my love will be taken care of. Simple as that. Simple as that. Entitled patients. Mm. There's some patients, not all, of course. There's some patients who, which the same, some of the same problems as a family member, think that they are the only one. They can literally hear down the hallway somebody screaming and yelling. They can literally hear the bells and whistles. They can hear a whole team running down with a crash cart, and yet they are the only one. You can give them every reason in the world, they're still not going to listen to you because you should have been right then and there. We got to do better. We have to do better. So we can't have that. So if you're a patient, please exercise better patience. Please. It goes a long way. It really, really does. It really does go a long way. Big time. Another reason, and speaking of managers, toxic work environments. You got managers that enable bad employees, don't correct behavior whatsoever. Somebody's late all the time, they let them stay late, or they lack professionalism and don't address it, don't do anything, don't do any corrective action, or they let the work environment, they let it be negative, or they let cliques hang around or mean girls. They let them hang around, and it brings the whole entire work environment down, brings the whole team down. So managers, some of y'all need to be taking accountability because the work environment could definitely be better if you wanted it to. If you wanted it to. But all these reasons right here, those are just some of the reasons why people leave healthcare. It's not all. These are just some. So the thing is, if we want healthcare to be a better place, we want healthcare to be in a better spot, all these things need to be addressed. All of them. And it takes the nurses that are there, it takes management, it takes your CEOs of hospitals, it takes the patients themselves, it takes the family members, it takes everybody involved to make this a better process. It takes everybody to make it a better process. And what will really help if people will be more understanding of one another. If people will actually communicate, if people will actually have a deeper understanding and a little bit of patience and a little bit of grace, it would go a long, long way. It really would. But y'all have to let me know. What do y'all think? What do you think about all these topics? What do you think about everything that we went over in today's episode? I really like to know. I mean, we talked about, you know, a woman wanting to cut off a foot for taxidermy. I mean, we're talking about, a nurse that's disappointed with the system in terms of what happened with him in Staten Island with another psychotic patient. I mean, we're talking about advice for 12-hour shifts. We're talking about, you know what I'm saying? Like reasons why people leave healthcare. Y'all have to let me know in the comments below what you think about this entire episode. Okay. But thank you for tuning in with your Wakanda RN. If you enjoyed the episode, please give me a like, a follow. You know what I'm saying? Let me know in the comments below what you think. You can always donate to the channel. It goes a long way. But I love you guys. I hope you have a blessed day wherever you listen to, wherever you're at. And I am out.